Janelle, I have a question for you now. So, what are your thoughts about cultural competency? What is it, and how does it play a role in your everyday work experience?
So for me, cultural competency is being aware of your patient population, but not only that, what are things that your patient population faces every day? You know, how do they get to the doctor? Are they working? Do they go to work? Are they stay-at-home parents? What are some of the things that they're dealing with in their communities, right? We're talking about Flint, Michigan. Water is a big thing in their community. If you're a physician who works in Flint, you should understand what does the patient population look like, regarding gender, regarding ethnicity, but what are things that they are facing day to day, but also the history there, right? I think that that's important to understand mentally where the patients are coming from. Is there a trust dynamic that there's an issue between, healthcare providers and patients, right? If you don't understand the history, then you don't understand sometimes people's actions and why they do or don't do certain things. If they're not compliant with their medication, it's not just because, they don't listen. Right? Is there a trust issue there? Is there an issue where they can't access their medications because of finances? Things like that. Those are parts of what cultural competency means to me.
So you mentioned trust dynamic. How, I'm Dr. So-and-so in a community, how do I gauge, where's my temperature gauge for trust dynamic? How do I get that?
Yeah, so I think that, you have to really be a skilled physician, honestly. And what do I mean skilled physician? I don't think that's a thing with time. I don't think it's about 20 years versus 5 years. I think it's more of a feeling and being invested in the patient and knowing and having that gut feeling. And if you can go into a room and having a conversation with the patient, but you don't feel that there is honesty or trust, then you feel that. If you go into a room and you're just there for numbers or you're there for time, then you won't understand that there are people who are not opening up to you, and it's not just because it's a time thing, right? So I think that sometimes it's a feeling, if that makes sense, that you can have whether or not someone fully trusts you or if they're just there because they want to get a medication refill.
Does it happen instantaneously? Is it something that happens over time? This trust?
I think for me, I would say trust is something that's established over time.